Assalamu alaikum and welcome to today's Health is Wealth episode. Today we'll be talking about diabetes prevention. It is always said that prevention is better than cure. And when we talk about diabetes prevention, we often refer to type 2 diabetes. And type 2 diabetes is often brought on by lifestyle factors. So things like unbalanced diet or inactivity can often give rise to type 2 diabetes. Today in the studio we have Dr. Aseem Malhotra, who is a consultant cardiologist with a special interest in lifestyle diseases. Welcome to the show, Aseem.
Hi, Nadia.
So we hear the term diabetes a lot. A lot of our relatives suffer with diabetes as well. Can you tell us, what is diabetes?
Well, diabetes is a condition related to the body's inability to metabolize glucose. It's a multi-organ, multi-system condition which is associated with increasing the risk of heart attack, stroke, kidney failure, eye disease, nerve disease, increases the risk of depression, increases the risk of developing Alzheimer's, and even increases the risk of developing many cancers. The majority of diabetes is type 2. About 90% of people who have diabetes have type 2 diabetes, which is largely preventable, and type 1, which is about the remaining 10%, which is not preventable, in fact is an autoimmune condition.
So, we talk about lifestyle changes that need to be made in order to prevent diabetes. Can you shed some more light on the kind of lifestyle factors we should be concentrating on?
I'm glad you asked that question, Nadia, because it's very important. Type 2 diabetes is really a condition you want to avoid if you can. Because of all the related diseases it's associated with, it contributes to a lot of suffering worldwide. We know that people with type 2 diabetes have a lot of chronic pain and a significantly increased risk of depression. But actually, the root cause primarily is related to poor diet. Specifically, it's a condition which really is associated with the body's inability to metabolize carbohydrates, and it's related, which are the biggest cause the biggest increase in insulin in the body. Insulin, as well as being a fat storing hormone, when the body cannot produce enough insulin or is resistant to the effects of insulin on the body, that's when you get type 2 diabetes. Right.
Gosh, that's very interesting.
So what's interesting in terms of the diet is actually not only is it preventable but potentially reversible, and apart from fasting, restricting carbohydrates is the single most effective dietary intervention at preventing type 2 diabetes and even reversing it in many people. So people who should really eat real foods and avoid things like sugar and what we call refined carbohydrates. So these are foods that are lacking in fiber, such as white bread, white rice, potatoes and chips, for example. These are very high starchy foods, and if you consume them in excess, it's going to increase your insulin response in the body, and over time it will significantly increase your risk of developing type 2 diabetes. But if you restrict them and eat more healthy foods like lots of vegetables and fish and olive oil and nuts, for example, then you can potentially reverse it and certainly reduce the need for medications.
Gosh, that's quite an important point to actually raise, that diet plays such a huge part in prevention for type 2 diabetes.
Absolutely.
But the other thing I wanted to ask though was, do you have any statistics on the prevention of diabetes versus the amount of patients that actually suffer with diabetes? Does it actually cause a difference?
Well, what's interesting is we know that the type 2 diabetes prevalence is increasing worldwide significantly. In the UK, we know there's around 3.9 million people who are diagnosed with diabetes now, and Diabetes UK have recently said this is at an all-time high. So we have a real problem with it, and it's mainly related to the processed food environment. There is also an issue of lack of physical activity, and that certainly does have an effect as well, and that can reduce your risk. So just doing something simple like a brisk walk for 15 to 20 minutes a day can significantly reduce your risk of developing type 2 diabetes.
So just moving on to your sort of previous point on the kind of foods that we should be avoiding and cutting out. So you said white breads and white rice. Now, many of our viewers actually indulge in those types of foods. So what can we substitute our white breads and white rices and pastas with?
I'm glad you asked that question. So one of the things, for example, I like to follow my own advice. I have a family history of type 2 diabetes, therefore I know I'm vulnerable, and we know there's a genetic predisposition, but it's something certainly I want to avoid if I can avoid getting it.
Absolutely.
So what I have done, for example, is I used to eat a lot of rice, and I've now substituted that for cauliflower rice. So actually, you can buy that now in Tesco.
Yeah, I've tried that. It's lovely.
Yeah.
Very nice.
And it's got more nutrition as well.
Yeah.
You know, you've got a lot of vitamin C, which is in cauliflower rice, and basically it's very easy to make. In some ways easier than actually white rice, because you just blend it and then you can cook it in butter, for example, which is absolutely fine. So these are the sorts of things you can substitute. In terms of bread, I would certainly advocate having brown bread and avoiding the white bread, so having more wholemeal. But again, ideally trying to avoid these sorts of foods or reduce the consumption of them, and just have a lot more vegetables in your diet
Right.
and a lot more fat. What people don't realize is that fat that comes from foods such as olive oil and nuts, these sorts of good fats, if you like, actually are very beneficial for your health and make you feel full, and they reduce your risk of developing many diseases, especially heart disease as well.
That's brilliant. Thank you very much, Aseem, for coming to our show today.
Thank you.
So there we have it. Diabetes prevention is as basic as eating more healthily and also being more active and fit. Eating more healthily constitutes as having a balanced diet, but in particular, reducing the amount of carbohydrate. Adding all these measures into your routine and your regime could potentially reverse type 2 diabetes, and that's a significant fact which I think all our viewers should take on board. So taking these simple, basic lifestyle measures can actually help you prevent type 2 diabetes. We really hope you enjoyed the show. Now it's time for our fitness segment with our personal trainer. Assalamu alaikum.
Okay, today what I want to talk about is getting the sides stronger. So the obliques and definitely around the sides here, if we get them strong and tight, then everybody's happy. So the first one we can do is a simple side plank, which has different levels of intensity based on your strength. The simplest way is to literally come off here, elbow to knee. Now if you're finding that's too easy, then we can literally come higher up into one leg, which makes that more difficult. Now for some, this will be quite challenging. A lot of people find this real tough. The next level up from that is to come off our toes. And then again, I'm holding this thing. You should feel this through here, and it should give a nice toning effect to the sides. Again, if that's too easy, I could come onto one leg. And again, if that's still too easy, obviously very strong, you can come down and up. All the ways with exercise, when you're exercising at home, just find the level that's right for you, which might be here to start with, and build up as you go from there. Obviously you do both sides, which will then get here. Then to get just around the front of the obliques, we can come into a half push-up position, hands together, and then what we're looking to do is just lift the hand up, and the obliques will have to work to hold your body in place. Now the key thing on this is the wider the hands go, the much harder this exercise gets. But for you to really work, you've got to hold this body still. What a lot of people do is when you lift this up, they sort of shift over, almost like you're dancing. That's not what we want. We want the body to be held in place. So when I lift this up, these muscles have to work. As I say, the wider you go with the hands, the much harder that gets. Final thing to know, if that gets too easy, you can always come off your toes, and then the same again. So these should get the whole obliques working from the very side to the side, which adds to the toning effect of our body.